Cholera in Africa, New Outbreaks, and the Impact of Tropical Cyclone Freddy. I'm Wayne Sharp, Health Media Specialist with the Internews Rooted in Trust project. And Internews is one member of the group hosting this dialogue. It's the Media Task Force of the Eastern and Southern Africa Interagency Working Group for Risk, Communication, and Community Engagement. My co-moderator today is OLANIYI, an Internews pandemic media mentor. He's based in Zambia. A new cholera outbreak has emerged just recently in South Sudan, continuing this crisis with cholera in the region. To make things worse, now we have Tropical Cyclone Freddy, which, according to the latest numbers I saw, has killed more than 300 people, and could have a negative impact on the spread of cholera in the affected countries in the region. So in this media dialogue, we have a WHO epidemiologist who will give us the latest on the cholera outbreak and perhaps how the cyclone could challenge the healthcare response in countries like Malawi, which is hardest hit by that cyclone. We'll also hear about a unique approach to cholera management by the Christian Health Association of Malawi. And we have Internews pandemic mentor, Dr. Jaya Shreedhar, on hand to counsel journalists on ways they can cover this rapidly developing situation. Just remind you quickly, we have a Zoom chat box. If you have a question that you'd like us to ask any of the speakers tonight, please type it in there. And my co-moderator, Tole, will ask them of the speakers during this hour. Okay, so let's get started. Dr. FELIX OLANIYI SANNI is a consultant epidemiologist and health data scientist with the World Health Organization based in Brazzaville. He supports monkeypox and cholera response. He has done that since 2022. Dr. SANNI holds a master's and a PhD in public health from the Federal University of Technology, Akure in Nigeria. His expertise cuts across public health, emergency management, epidemiology, economics, and business sectors across the globe. And he joins us today to give us the latest on the cholera outbreak in the ESAR region. Dr. SANNI, welcome to the dialogue.
Thank you. Thank you for having me.
And please, whenever you're ready, you can proceed.
Okay, thank you. Can you allow me to share my screen?
Yes, yes, please do.
Is disabled?
Okay, I think Christoph can enable that.
Okay, thank you.
There, good, we see that.
Great. Good, let me quickly give a brief overview of cholera situation in Africa. And I am standing in for Dr. Patrick Otim Ramadan, who is the incident manager for cholera response in Africa, with WHO Africa. So let's quickly move to the current situation in Africa. Only the first 2 months of 2023, the cases of cholera reported in Africa has increased close to about 40% of the total cases reported in 2022, the entire 2022. And the cholera is happening in Africa in the following context. The first one is a natural disaster, the cyclone that is ravaging Mozambique, Malawi, and flooding in Nigeria, also Malawi, making two things together in Malawi, and drought in Kenya, Ethiopia, and Somalia as well. Also, some countries are facing conflicts like Cameroon, DRC, Nigeria, South Sudan, Ethiopia, and Somalia. And there are many people trooping to the internally displaced camps. Also, multiple other outbreaks in Africa, for example, mpox in some countries like DRC, Nigeria, and some other countries in Central Africa, while on the vaccine-derived polio, measles, and COVID-19 pandemic. Also, Africa is facing the challenges, including limited and strained resources, a shortage of medical commodities such as cholera kits and oral cholera vaccine, also part of the challenges that we are facing here amidst cholera outbreak. Poor sanitation and unreliable water supplies, so another challenge here. And amidst increase in the border movement, that is, we have been witnessing that along, for example, in Mozambique and Malawi. This is the trend of outbreak since 2012 to 2023. As you can see, the highest cases, the highest outbreak was recorded in 2017. And since then, even though with the launch of ending cholera, a global roadmap to 2030, cases outbreaks are still very high in Africa. Looking at the 2018-24, another one on 24 in 2021. And the first quarter of 2023 alone, you see, we have 13, which is almost or more than half of what was reported in 2026, which means we have a lot to deal with in Africa in 2023. So far, from 2012 to 2023, 20 countries have been reporting cholera cases on a yearly basis. Let's look at the cases and deaths from January 2022 to 2023. The total of 13 countries have been reporting cases since 2022, with a cumulative of over 134,000, and the cumulative death is over 3,000, with a CFR 2.3%, which is still very high. You can see from the left-hand side here, you see here, Malawi alone from 2022 has reported over 53,000, with over 1,600 deaths, and the case fatality there is 3.1%, very high. In 2023 alone, Malawi has recorded over 23,000 as at March 2022, March 12, and followed by Mozambique. Mozambique has reported over 6,000. So the proportion of cholera cases reported in Africa, Malawi alone has recorded over 50%, almost 60% of all cases in Africa, followed by Mozambique, 15%, and the Democratic Republic of the Congo, 13%. This is the situation in Africa from January 2022 to March 12, 2023. Although we have been witnessing decrease in cases since week 6, 2023, we cannot conclude now, because there are a few other countries are reporting cases now, like South Sudan. You can look at it from here. This is the epic curve from 2022 to 2023. This is for 2023 only. So the highest cases, number of cases was recorded in week 5. And since then, we have been witnessing experiencing decrease in the number of new cases due to intervention from various stakeholders. The top 3 countries that reported cases in 2023, as I've mentioned earlier, include Malawi, which has the highest number of cases, though it has been decreasing since week 6, and Mozambique. You see, for Mozambique, the cases have been increasing from week 7. It comes down a bit in week 7 after week 6, and it's also started increasing from week 8 to present. The cases in Malawi are increasing. Kenya also, we witness increase in cases, and relative stable between week 7 to week 9, and a bit lower in week 10. But we cannot conclude yet, because there are some cases that might still come after that. So that we see often. Let's compare the cases reported in the past 2 weeks. About 3 countries reported increase in cases. Burundi recorded over 285% increase, from 7 in week 9 to 10 to 27 in week 10. Also, Mozambique recorded less than 1,000 in week 9 and over 1,000 in week 10, with an increase of 24.9%. Likewise, Tanzania recorded 4 cases in weeks 9, and in week 10, it increased to 15. That is almost 300% increment. Then the total cases decreased when we combine all the countries together. The cases decreased by 16.2% in week 10 compared to week 9. Concerning deaths, Malawi and Mozambique, Malawi reported a decrease in deaths of almost 50%, whereas Mozambique, on the other hand, the number of deaths increased by 100% from 5 to 10. So overall, in the week 10 compared to week 9, there was a decrease in deaths by 33.7%, which means it reduced from 70 to 54. Let's look at the Malawi situation. Since March 2023, there has been extensive flood, mudslide, and strong winds in Malawi, and this one has caused several displacements and the flooding of refugee camps, then into temporary shelters. Then the disaster has displaced several household damage, household properties. There are so many injuries, damaged infrastructures, and several deaths resulted in several deaths. Also, Cyclone Freddy that started in March 14 continues to cause flooding, mudslide, and heavy winds in the southern region of Malawi. 10 districts and 2 cities have been affected since the onset of the torrential rains that was induced by Cyclone Freddy. The districts the affected include Balantre, Shirikawa. I will still look at those districts in the next slide. Altogether, over 13 households have been affected, with over 4,000 people displaced, and people moving to 57 available camps that have been established for internally displaced people, and more than 190 people deaths have been reported, with almost 600 injuries, and about 37 people have been reported missing in Malawi due to the Cyclone Freddy that is affecting the country. In 24 hours, Mozambique recorded 218 that we report for March 13, 218 new cases with 8 deaths. And altogether, although there was a decrease in the number of new cases by 21.5% in week 10 compared to week 7, also there was a decrease in deaths, as I have already said earlier. Concerning districts that are reporting cases, Longwe reported the highest number of cases. In just 7 days, they reported almost 800 cases. Balantre reported over 600 cases within 7 days, followed by Balaka, 144 cases. Let's look at the cases in Burundi. Altogether, Burundi has, in South Sudan has reported 269 cases since the first outbreak that was reported on the first case that was reported on the January 22nd, with 1 death so far. The CFR is 0.4 as of 11th of March 2023. And the mostly affected age group was age 1 to 4, which accounts for about 83% of all cases in the country. So most areas affected include Jalaba 25, Malakia 21, Asosa 23, POC 20, and the rest are less than 20. Oral cholera vaccination campaign began yesterday, and it is targeted towards about 53,000 individuals, particularly those aged age 1 and above. Outbreak is mainly in the Malakai district, which is and the other small counties around that area. Then overcrowding is a very big challenge in the South Sudan, particularly in POC, due to continuing influx of IDPs. As I said earlier, that conflicts and affecting some of these countries. Then the major challenge is limited wash facilities. Cleaning and installation of water storage are ongoing there, and facility assessment is also ongoing. These are the responses that have been in place so far in Africa. High-level ministerial meetings on cholera and climate-related public health emergencies have been ongoing in countries. Also, technical experts who have been deployed to countries like Malawi, Kenya, and Mozambique to support the countries. So also supplies for case management lab and wash commodities have been improved in Africa. Then the surveillance has been heightened, especially for cross-border cases. Also, community-based intervention for IPC, wash, surveillance, RCCE, and management have been integrated in countries also. Then there is ongoing training of healthcare workers on the case management. Also, WHO is supporting the establishment of chlorine residual test kits, and as well as oxidation reduction potentiometers with communities, including wash and IPC activities. Also, there is an intensified community engagement and risk communication. Then also OCV campaign is going on in the DRC, Kenya, as well as Mozambique, which are among the countries that are reporting the highest number of cases. Also, there is an ongoing support for countries to scale up the readiness. These are the key challenges. As I said earlier, competing priorities include conflict, flood, drought, and other disease outbreaks, including mpox in Africa. Also, Cyclone Freddy is posing a serious challenge in especially the two major countries reporting cases, Mozambique and Malawi. Also, there's limited resources, both financial and human resources are limited in Africa. Also, inadequate staff training, especially on case management, is affecting some countries. Also, inadequate supply of inadequate medical supplies, laboratory reagent, and shortage of beds affecting the response to cholera in Africa. Also, limited wash and access to latrine, potable water, and in some cases, health services, other challenges affecting Africa. And they also delay surveillance and data management is another important challenge. So let me quickly give the summary of what I've said so far. 13 countries have confirmed cholera outbreaks in Africa, and overall there have been decrease in the number of cases and deaths since week 6. But we still keep on responding to the outbreak. So we hope to keep this thing, and we hope to see cases tailing in the next few weeks. Also, in week 10, increase in cases was still observed in some countries, including Burundi, as I've shown earlier, DRC, Mozambique, and Tanzania. But Kenya and the Malawi cases are decreasing, but too early to judge, because Kenya, for some times now, cases are relatively stable, which has caused for concern that we need more intervention so that cases we begin to go down, which we have witnessed a slight in the week 10. We hope to see more this week and the coming weeks. Also, Cyclone Freddy in Mozambique and Malawi is posing a serious risk of transmission maybe in the next 2 weeks or beyond that. Thank you for listening. That is all from my side.
Thank you so much, Dr. SANNI, for that excellent presentation. Now, we have questions. Our journalists and other participants have questions, and we will get to those. I just want to quickly introduce our Internews media mentor, Jaya Shreedhar, who's going to be providing sort of a journalist perspective on how to cover all of these aspects of the cholera outbreak. So Jaya, I'm bringing you in case you also want to respond to some of the questions that we're going to pose here. And I will hand over to Tole, our co-moderator, to give us some of those questions. Tole?
Thank you very much, Wayne. So we have a number of questions here. So we'll take a few for this first round. And the first question is, are the 6 revised cholera kits by WHO from 2016 still in use? And the second question is, how effective are the oral cholera vaccines? And relating to that, are these vaccines available in public health facilities in African countries? And how affordable are they? That will be it for the first round. Thank you.
Thank you very much. Number one, I will give you response based on the knowledge I have. I may not be able to give you all the response to all the questions you have based on my department, notwithstanding concerning whether the OCV are effective. Yeah, they are effective, and the WHO is working with countries. For example, Malawi, the rollout of OCV is ongoing there, and as you can see, since week 6, we have been seeing the decrease in number of cases. So which is being extended to other countries. As I said in one of the slides, I also mentioned, I don't know if I can as well show that quickly, on cases in Burundi, sorry, in South Sudan, sorry, talking about Burundi, that cases about 53,000 people are targeted. So we have seen cases, and in Kenya, in Malawi, we have seen cases coming down. As I said earlier, that though it was too early to say, but intervention with OCV has proven very effective, and the cases are coming down. So thank you for that.
And there's a question where they ask, how available are they and what is the cost?
The vaccines are available, and as it stands now, WHO is supporting countries with providing OCV for countries. So the cost, I may not be able to give you the cost, but for the countries that is affected with that is facing cholera burden, WHO is supplying OCV in conjunction with the Ministry of Health in the countries.
Thank you. Wayne, I still have one more question. We go to Jaya first.
Yeah, thank you. Yeah, go ahead, Wayne.
No, I say, yeah, Jaya, go ahead if you'd like to speak, please.
Sure. I was actually interested in hearing that the journalists are extremely focused on the issue of the shortage in cholera vaccines, and there's a lot of reporting, I think, on the importance of cholera vaccines in the current and the other outbreaks. But I really think that together with talking about vaccines, we also need to look at the WASH aspects of this in greater depth. And I'm just thinking maybe, journalists should be talking about the importance of investments into infrastructure for better sanitation, for better water supply, and for personal hygiene, making clean water available in households and hospital facilities and in shelters. If we're ever to get these outbreaks behind us. So I think vaccines are not the only solution. I was thinking that I would sort of come in with a few points after Dr. Gama had a chance to say his piece, because he's going to talk about the One Health approach. He was here a minute ago, but I see he's vanished again. Dr. Gama, are you there?
Yeah, the technical problems for him today have been really vexing.
Yeah, I think Cornelia is sort of ready to sort of read Dr. Gama's talk. So should we go to her and then come back to me? Is that okay?
I think that's fine. Yeah. I'll just for our participants, I'll just talk to you about the group that's going to present next. It's the Christian Health Association of Malawi, which delivers a large amount of health services in that country, pursuing a One Health approach, as Jaya has mentioned. The One Health approach, they will explain it, but it acknowledges that the health of humans, animals, and ecosystems are closely interlinked. So the group CHAM, Christian Health Association of Malawi, is employing this kind of a One Health approach. And so, yes, why don't we now welcome Cornelia? Oh, I see Dr. Gamma is there on the screen, but I don't know if he can hear us. Can you hear us, Dr. Gamma? I think not. So perhaps, okay. Cornelia, would you like to go ahead?
Yes, I would. On behalf of Dr. Gamma, thank you, Wayne, the Internews team, and good evening, everyone. Today, I'll be sharing on behalf of Dr. Gamma what we have learned as a faith-based organization working in the front lines of the cholera response in Malawi. The Christian Health Association of Malawi and WaterAid have joined hands to improve water, sanitation, and hygiene measures to make a lasting impact on communities affected by cholera. And we believe that that a broader multidisciplinary approach is needed to find a lasting solution to cholera, and an approach that includes but goes beyond the health sector. Trying to start the video. Cholera is not new to Malawi. It visits Malawi periodically, never goes away without taking away near and dear ones. Does cholera come uninvited? The answer is no. Many factors come together to invite cholera bacterium to come into the communities. And that is why the disease persists as an important public health problem in many low and middle income countries, and in this case, Malawi. Vaccination against cholera is being recommended for the prevention and control of cholera. And there are stories in the media about the cholera vaccine shortage and how that has been putting lives at risk. The vaccines offer some protection that lasts only about 3 months, typically requires a 2-dose series with at least a week in between doses. And in reality, the scientific evidence, especially data on disease burden, cost of illness, vaccine delivery costs, and cost effectiveness to support a wider use of vaccines is still weak. Vaccination against cholera is a stopgap measure. So where is the solution? We need to understand cholera better, because when you think about it, it is clear that cholera outbreaks happen when certain separate events intersect. A likely recipe to set off a cholera outbreak: first, sewage containing the cholera bacteria is set out to sea somewhere, and ocean currents carry the bacterium along the coastline. Then thematic climatic events like El Nino, for example, bring rain and wash more nutrients from the soil into the sea, warm up the surface of the sea. Sea algae and plankton, like these warm temperatures, will multiply, bloom, fed by the sewage and nutrients. The cholera bacterium in the sewage thrives, multiple inside the plankton, and gets washed by the tides with the algae and plankton into rivers. Bacteria becomes available in plenty in brackish black waters. A young boy somewhere in a village will go to the river, drink the water. Along with the water, he will swallow the tiny organisms in the plankton and algae called copepods. Each copepod can carry up to 104 cholera bacteria. His mother will fill a pitcher, same water for the household use, just as the neighbors do. And why? Because this said village has no proper supply where water would be treated to kill any germs. Some of the villagers are headed to a village in Malawi for a wedding or an event, and they carry the same water to drink on their journey. and so carry cholera into a country with no coastline, no backwaters. Most households in the villages, in the coast and in Malawi don't boil the water before drinking because there's not much public awareness about waterborne diseases. Villagers will start falling sick, people have watery diarrhea and vomiting, but the village has no proper toilets. Those with cholera contaminate their bedding, surroundings, and household members help them clean up. Because of no clean water, no soap to wash hands, household members get infected as well. Some years ago, there was talk about building a good water supply and sanitary system for many villages in Malawi, but the plans never materialized and people forgot about them. No one reminded them, no one, including journalists. Near one of the villages where cholera was raging was a shelter for displaced people from neighboring states. These people have been forced to flee their homes because of flooding. The shelter has no toilets, water supply, soap, provisions for hygiene, and people were all drinking water from the same storage containers. They are also crowded together and malnourished for want of enough food. The village health workers who are attending to the cholera patients in the village also took medical supplies to the shelter for displaced people. Pretty soon, water got contaminated when cholera broke out in the shelter. It claimed many lives very quickly because people were poorly nourished and had no proper medical facilities. Journalists had done very few stories about the health risks faced by these displaced people because editors felt there were more other important stories to cover. Pretty soon, the cholera outbreak spread to other villages and thousands of lives were lost. Why? Because people thought you needed medicines and antibiotics to cure it. They did not know that what killed people was severe and rapid dehydration. If there had been clean drinking water, if they knew how to boil the water, mix it with sugar and salt, they could keep a patient with cholera alive until they reached a health facility. Cholera happens because of the interconnectedness of people and the environments, and in this case, plants like algae, and that is why cholera is a One Health issue. Simply put, what can help prevent and control cholera and save the lives of communities is high quality water supply facilities, sanitation infrastructure, and personal hygiene. This means that we need town planners, we need engineers, we need journalists and policymakers, community advocates, and investors to overcome cholera. Simply put, the One Health approach to cholera is about different disciplines working together, each bringing their expertise and experience to the table. And if we fail to do so, the human and economic costs will be heavy. A study done in the Machinga and Zomba districts of Malawi in 2017 found that the average cost to patients' households and health facilities for treating an episode of cholera amounted to $65.6 and $59.7 in 2016 for households and health facilities, respectively. Costs incurred treating a cholera episode were proportional to duration of hospital stay. Moreover, 52% of households used coping strategies to compensate for direct and indirect costs imposed by the disease. All these findings have direct policy implications. We need to reframe cholera as a One Health issue, and journalists need to help policymakers and the public understand and support the approach. We need to bring on board town planners, engineers to design high quality water supply networks to ensure that people have safe water to drink and to use for their daily needs. We also need well-designed and maintained solid and liquid waste management infrastructure to ensure safe disposal so that adults and children do not get infected through exposure to contaminated water and feces. Journalists need to work hard to better explain the link between climate change and cholera to help audiences understand how a faraway climatic event like El Nino can today upend the health and lives of your young ones tomorrow. Cholera vaccines are fine, and they are a supportive strategy, not the long-term solution. Cholera is a One Health issue regarding and needing One Health approaches. Water, sanitation, and hygiene facilities must be installed and strengthened across Malawi to protect the citizens of Malawi from the current and future outbreaks, and faith based health organizations like the Christian Health Association of Malawi are taking the long road in pursuit of health security for our communities and countries. We as journalists have a critical role to play to help Malawi do so. Thank you.
Thank you so much, Cornelia, and thanks for reminding journalists that they have a role to play in the One Health approach to dealing with these health issues. Tole, do you have any questions for Cornelia?
Yes, we have Abel Cafera, who asks CHAM. He says, we are struggling with the current cholera outbreak. How prepared are the health facilities, and are they prepared enough to deal with the problem when it starts rising? Also, he asks, what are the challenges CHAM has been experiencing in the current outbreak, and what are they doing to overcome the challenges? We also have Patrick Parker from Blantyre, who's asking, after Cyclone Freddy, what is CHAM doing to provide potable water to communities to help control the cholera pandemic? Thank you.
Thank you, Tole. I will take the second question first on preparedness and what CHAM is doing in response to the cholera outbreak. If you are familiar with the Christian Health Association of Malawi, you know that they have multiple health facilities in 4 districts in Malawi. These are 51 total facilities in Lilongwe, in Blantyre, Mangochi, and Zomba districts. And looking at the maps of the disease coverage, these are hotspot areas for cholera. Some of these CHAM facilities in the hotspot areas are actively admitting cholera patients, providing first-line care to the newest cholera cases, and also providing PPE for the health workers in Malawi in the hardest hit areas. At the moment, the Christian Health Association of Malawi is receiving active support from humanitarian partners, 2 of them being the Red Cross and Médecins Sans Frontières, that's Doctors Without Borders, who are actively supporting in terms of logistics, human resources, and cholera supplies. CHAM is reaching out to the Malawian government with an appeal to support with stocking of oral cholera vaccines, especially in Likoni Mission Hospital, which you know is one of the CHAM facilities that is actively admitting cholera patients and is facing major stockouts due to the outbreak in the country. The CHAM team is reaching out for support with stocking of vaccines, PPE, and wash equipment. The question on preparedness, I would like to invite my colleague Jaya to take it on my behalf. Jaya, if you could please, thank you.
Yeah, well, I think I'm an honorary colleague of CHAM. Thank you for that. Yes, yes, I think that's what I was going to talk about, you know, the whole preparedness aspect. It looks like we're trying to put out a house that's on fire, you know, for some months already. And I think that while we're doing stories on improving access to vaccines and to make sure that emergency response measures are being carried out on the ground, we need more money, we need more chlorine, more IV fluids, medicines, and you know, oral rehydration salts. All of these supplies need to reach the places where they are most needed. There's also this other aspect of if there's flooding in those districts that apparently CHAM also works in, and you have you know, all the you know, elements of a disaster in the making for another cholera outbreak, what are going to be the things that humanitarian actors on the ground, you know, doctors, UNICEF, WHO, the International Committee of the Red Cross, and the Christian Health Associations all got to join hands to sort of try and prevent it. We need a lot of disinfectants. We need to transport people out of the disaster zone areas into shelters. But in the shelters themselves, we have to be able to ensure access to clean water. Otherwise, again, we're setting up another, conducive environment for transmission. So it's a very, very challenging situation indeed. And it's really heartbreaking to see us all going through this, trauma for a disease which is centuries old, against which we have an effective vaccine, we have a medication, and above all, we have a household remedy in the form of just salt and sugar mixed with clean, safe drinking water that could save the lives of people before they get to the hospital. So we have all that, and yet where are we going wrong? So which is why I felt that journalists, we really need to start reframing cholera as a One Health issue, which requires a long-term vision and a long-term strategy. I mean, from Dr. SANNI's slide, we have no less than 20 countries in Africa that have experienced cholera outbreaks on average, over the last 12 years. And so cholera is not just an immediate crisis. It's always around the corner waiting to jump out at us. And why is this happening consistently over the last dozen years or so? Because we're not thinking about cholera once the outbreak is over. I think the real reporting on cholera preparedness needs to happen between the outbreaks, where as soon as the outbreak, goes down and, the cases are coming under control, the cholera shouldn't vanish from the pages of online media, from the airwaves, television screens, and our newspapers. We need to come back to say that the situation is still very vulnerable. I mean, we're just waiting for the next flood to happen, for the next El Nino event that can again, bring about an outbreak. So what are some of the things that we can do to, educate audiences and to put pressure on policymakers and decision makers to start investing in cholera preparedness now? So I can we've at Internews, we created six basic principles that journalists can keep in mind when reporting on One Health issues. And, how do you really frame and tell the cholera story from using the One Health approach? And how can we set the global and the local agenda and mobilize all of these remedial actions, not only from policymakers, but also from the public? So everyone has a role. It's not the government acting alone or the WHO rushing in like a savior on a white horse all the time. As community members, we too have a role to play to demand that we have better, cleaner, safer environments in which the cholera risk is vastly reduced. So the first principle I think that we need to keep in mind is respect diversity. So if we recognize that every living being has an intrinsic value, which transcends our economic status, our race, and all of that, no matter which community we come from, we all need access to good, safe environments to live in. So this really means, as journalists, we need to go out and find those communities that are most vulnerable to the next outbreak of cholera, or who are currently experiencing, the hardest impact of the outbreak. So why are they suffering? Why are they being left behind or falling through the cracks of available development assistance? Or why are they being ignored by communities? And so those are the truly vulnerable, most at-risk populations that we need to highlight and visibilize in our stories, and go there, talk to them, find out what the problem is, and try to find ways to divert some attention to them, whether it's in the form of funding or whether it's in the form of better health education and so on. So the first principle is to respect diversity and to highlight the voices of those who are being marginalized or left out of the outbreak response. The second thing I think is really, the second principle is to focus on the present. We think that things like climate change are faraway events. They're very slow drip issues, slow burn issues, which happen over a period of centuries. Yes, while that's true, we are seeing climate change happening right now all around us. It's beating on our windows, it's bringing our roof down, it's flooding our crops, it's bringing diseases to our doorstep. So the immediacy of climate change really has to be explained to audiences. Every time we do a story on cholera and we talk about flooding and, Cyclone Freddy and so on, we need to bring out that connection between climate change and the risk of cholera outbreaks. That needs to be dinned into the public's mind, that this is a climate change issue, and unless communities unite to advocate and put pressure on policymakers and global bodies that global warming must be slowed down, the climate change mitigation measures must be adhered to by countries around the world, we can't, hope to come out of this mess that we find ourselves in. It's going to get worse. We're going to see more landslides, more flooding, rising of coastal waters, and that's going to really affect those communities who are most vulnerable. So we have to focus on the present, but we also have to remind people about the past, namely that for the last 12 years, 20 African countries have been seeing cholera outbreaks. This is like an action repeat, right? Year after year after year. What should we be doing differently that should change things? So yes, focus on the present, but also give them a historical perspective. The third thing is, I think, to dispel mis and disinformation around cholera and about the One Health approach, and also to tell them about oral rehydration salts. That really is the life-saving story. We have an oral rehydration day coming up as well. So this is a good chance, no matter how many times we repeat how to make the oral rehydration solution at home on your stoves and give it to your people with cholera in the household, we'll be saving that many lives. So keep visibilizing and forefronting that very simple community-based sort of remedy to overcome cholera. So we have to frame climate change as an immediate intersectional issue as well, but we also have to dispel conspiracy theories about climate change and to dispel misinformation about climate change, that it is not something that will happen to us, it's already happening to us. The fourth principle about the One Health approach and helping audiences understand the links between human health and the environment is to help people understand the science behind One Health. So whether, that means that journalists have to understand the science behind One Health ourselves, right? So the way to do it is to talk to scientists who are working on that problem, talk to people working on the issue, working on One Health within the WHO who are accessible to us. We have Dr. SANNI here, and several of his earlier slides talked about how frequent the cyclones and the flooding have been, how often the drought is happening, and why all of these are linked to the cholera issue. So we need to explain the science, tell the story like, how Dr. Gama explained so beautifully about, the sewage coming down the coastlines and the plankton blooms, and the cholera coming into the brackish waters, going into villages. You could really simplify it and explain the science behind One Health to people so that they can better understand what these interconnections are and find out how to take measures to protect themselves. The third, the fifth thing is really to promote a better exchange of information between scientists and our governments. Sometimes scientists and politicians don't talk to each other. There's a huge information communication gap between the two. Scientists come out with excellent research papers and findings that predict cholera outbreaks. Now they're talking of satellite technology that studies what the ocean currents are like, and they can track algal blooms and plankton blooms from their satellites. And they can tell you when at times when the plankton blooms and algal blooms really just, escalate like that, there's a strong possibility of a cholera outbreak a few weeks down the line, as the algal blooms are washed into the rivers and villagers, take that water. So using such science and technology, that's available today to us, and being able to predict these outbreaks, that kind of science needs to be relayed to policymakers. The science of prediction and the science that tells you that these are the environmental measures that are proven to give communities protection against the risk of cholera transmission. Those studies need to be visibilized by the media, and you should be interviewing politicians to ask, how do you react to this science? How are you reacting to this data about climate change? And what are you doing to put in place measures that can protect our community from the impacts of climate change? And I think the, last sort of a measure or principle to follow when reporting on climate change is really bringing community voices into your stories. Every one of the people who are living on the edges of that flood, or whose lands have been washed away in that landslide. I mean, these are the voices that really need to lead our stories. They're living climate change, and they're living the cholera outbreak, and they're living the risk of so many diseases. So their voices, their feelings really need to be flagged up to put a human face on One Health and to help communities better relate to it. So these are our 6 principles, and I'm happy to share a one-pager on this later. We can drop a link in the chat, perhaps. And now I'll hand it back to Wayne, and I'm happy to take questions as well. Back to you, Wayne and Tole.
Thank you so much, Jaya. Yes, I think it would be great if you could share those 6 points. I think that's a really handy help for journalists covering the subject. I guess I'm curious to hear a bit more about the challenges that the Cyclone Freddy. Perhaps Cornelia and Dr. SANNI, either or both, could talk about how much harder is it to handle an outbreak of a disease when you have a natural disaster like that. And it's, as Dr. Jaya says, this is now, with climate change, these weather events are going to become more and more common. Could either of you or both of you give us an update on how challenging that has been? And I put that question out there either for Cornelia or for Dr. SANNI. Either of you can address it if you like.
Thank you, Wayne. I'm going to make an attempt at addressing this question, then invite input from Dr. Jaya as well. The risk of cholera has been going up since the cyclone wreaked harm on the landscapes in Malawi, and especially in the southern part of the country that has a lot of refugees, a lot of displaced people who do not have proper wash infrastructure, and that highly contributed to the spread of the disease. As you know, and according to the WHO statistics, this is by far the deadliest outbreak of cholera in the country. One of the most pertinent results of this, and that is highlighting a gap, is how prepared the country is in general through government-led interventions to deal with a double tragedy, that is a health issue plus a natural disaster issue. The gap is quite glaring. And as I mentioned earlier in the talk, that humanitarian partners are really coming together to try and bridge the gaps, in that they are providing shelter, might not be well constructed and well equipped shelter, but they are providing shelter. They are providing basic necessities for the hardest hit areas. They are also coming together. As you know, they put out an appeal to the government to as well double their effort. As you know, part of the government response has been to increase funding towards cholera and to also include cholera into the COVID-19 presidential task force. And what the task force is currently doing is visiting these hardest hit areas to collect data, to assess the most rapid and most pertinent needs that can be addressed immediately, and assisting to channel some of the funding from the initial COVID task force to deal with cholera as an ongoing public health issue in Malawi. Because of Cyclone Freddy as well, there has been more displacement, and not just from the existing displaced people's camps. There has been more displacement due to flooding of the lower lying areas of Malawi, and this has also contributed to the spread of cholera among displaced people. So a lot of humanitarian effort is being channeled to that side, but there is still a large gap that the government and humanitarian partners need to come together to address. This requires a multi-sectoral approach, not just the health ministry. This also is an issue for immigration. This also is an issue for climate, natural disasters, and this is also an issue for the Interior Ministry. So they require a multi-sectoral approach to address the most pertinent gaps. I will be handing over to, again, our honorary colleague, Dr. Jaya, to build on my discourse. Thank you, Jaya.
Yes, and Jaya, while you're at it, you can also answer the question which is on the chat, where they're saying, we have a cholera outbreak now. Should we expect a malaria outbreak too? And is it advisable to sensitize the communities on how to prepare to reduce the infection for both? Thank you.
I really do believe that Dr. SANNI is best placed to answer that question. So with your kind permission, I'm going to, may I direct the question to you, Dr. SANNI? Yeah.
Sorry, let me talk about the first question that was posed here. I am not in Malawi, but based on the report we have been receiving from Malawi, cyclone has impacted the outbreak in a very serious way. For example, damage to water and sanitation infrastructure have been reported in Malawi and a few other countries, which I know that has been causing a lack of access to water, and that has been causing a lot of problem. Also, displacement of population. I reported in my during my presentation that there's some congestion in some areas because the people are displaced, and many people are scouting for limited resources. There is another thing that is impacting the cholera outbreak in the country. Also, weak health system. I also reported that some health infrastructure were damaged. And so that also is another challenge there. Also, limited resources, where there is no enough resources to put things in place. I reported it that, for example, in South Sudan, 57 camps were established. All the 57 camps were flooded with people moving from one place to another due to conflict, and that's also that is what is happening in Malawi. In the report, I said it earlier that about 37 people were missing, and over almost 600 people were injured. So, and also with limited resources, it's really a very serious challenge to cholera response in Africa. So, what about the second question, please? I didn't get the second question.
Tole, can you repeat your question for Dr. SANNI?
Yes. So the second question is, should we expect the malaria outbreak too? And is it advisable to sensitize the communities on how to prepare to reduce for both infections, malaria and cholera?
It is difficult for me to answer that question, but it's not what we shouldn't expect because of the impact of a cyclone in the environment. So it's likely that malaria will increase, and also it is important to sensitize the community. I think that one is ongoing with the RCCE and part of the WHO. So efforts are ongoing to reach out to the countries, not only on cholera, also prepare them for other possible outbreaks or other diseases that due to displacement and the flooding or the limited resources can pose to the countries. Thank you. That is the little I can input on that.
Thank you. Back to you, Wayne.
Thank you. I think, well, we're at, we did start a bit late, but we are close to the top of the hour. So if there are any concluding statements, please offer them now. And if not, I would just like to thank all of our speakers for joining us today. Dr. FELIX, SANNI, Cornelia Mukandi, Jaya Shreedhar. Thanks very much to Dr. Billy Gama as well, although I'm sorry that for technical reasons we were unable to talk to you today. We will try again and work on these technical issues. I'd just like to let everyone know that we will send a recording of this dialogue to everyone who joined us today. We'll also send audio excerpts of today's presenters to our full journalist network via WhatsApp. We'd love to hear from you, how useful this information that we're giving you is, how it could be better, what topics you'd like to see in future media dialogues, please let us know. And for now, until next time, on behalf of the RCCE Media Working Group and my co-moderator, OLANIYI, I'm Wayne Sharp. Thanks for joining us and stay safe. Bye-bye.
Thank you. Bye-bye.
Thank you all. Bye.
Thank you. Bye.
You are waiting for that thing. And we need for the